Hi, Dr. Bo here again, Dr. McLaughlin. Wanted to go over exactly, or near exactly, that I can explain what happens in this lumbar spine that I complain about people just turning it and cracking it. Again, if you turn the lumbar spine and it's already curved, in order to turn the vertebrae, it has to be straightened. And that's not what we want. That's why people sleep on blocks and so forth, because we're trying to train the curvature in here. And of course, a little sneak peek, future videos, the thing that causes the spine to stay in this position is called the anterior longitudinal ligament. It runs along the front of the spine from top to bottom, anterior longitudinal ligament. And that ligament shortens from being forward for many years. It's like if I hold my arm like this for a month, I'm not able to straighten it because the ligaments get tight on the inside. Same thing happens if you keep your back straight like this from sitting in class or slouching on a motorcycle or slouching in your lazy boy chair. It ends up, this ligament pulls you down, pulls your head down, and you end up with a tight ligament. So after the chiropractor gets done working his miracles with these joints, making them like each other again, inducing the curvature, you want to get out and you want to lay on the things we call dental rolls. So Dr. Dennerman invented those. It's with CBP, Chiropractic Biophysics. And they invented these things that are dental rolls, and they basically are made so cool. I should have one here. I don't. Yes, I do. Hold on. Okay. And this is the dental roll. Look at the lovely shape it is. That's the shape of your lumbar spine that it's supposed to be. So as you lay back, here's your lumbar spine. You lay on the lumbar spine. Can you see how the sloped part, this goes against your booty, and this sloped part holds this slope here from not going any further. Go no further, thou shalt not pass. Right? It stays this curve. And it's got a high spot here, the way it's made, that will induce, because this part here is usually flat from people holding their breath. This is the diaphragm right here. This is the front, right? This is the back of the spine. This is the front of the spine. The patient's laying on his back. Legs are down here. Right? And there you go. You're just laying there like that on your dental roll. And we give the dental roll after the adjustment. If you try to do this to a spine that hasn't been loosened or worked a little bit, it ends up being damaged by overbending the low back. And that's what this device is meant to do. I've never heard this explained to me. It's just what I've sort of come up with. So beat me up if I'm wrong, or let's discuss it. It holds this slope holds this and says, go no further. And then this high spot says, you go further. So it's trying to, in my mind, steal, like take away, steal curvature from here and move it to here. Let's go over what I usually find on x-ray. On x-ray, I usually find the spine like that, with no lordosis, just straight. The patient comes in, we take a side view, it's like that. And then the bottom, you see the bottom, is doing all the forward curvature. So all 23 degrees, whatever it is, of this curvature here is being done by this one or two guys. He's doing everything. And these guys are usually straight. So when the dental roll comes in there, after we do our adjustments and get it moving a little bit, we're trying to steal the curvature from here. So straighten this out a little bit and then move some of that up to there. So the whole thing shares the curvature. I hope that came out on the camera. So usually it's straight and then all the curvatures. And what we're trying to do with the adjustments and the dental roll placement and spending 20 minutes, they took the ligament out of here and they held it stretched for 5 minutes and it sprang back. They held it for 15 minutes and it sprang back. They held it for 20 minutes, stretched, and they let go and it sort of stayed there. So we know that the biggest bang for your buck is around 20 minutes to stretch that ligament with the dental roll. So you get on your dental rolls, reshape the spine, steal curvature from the bottom to move it to here, and stretch this anterior longitudinal ligament. You get to 15 minutes, you're ready to just bust because it just hurts so bad because it's just starting to stretch at 15. Hey Mary, how's it going with your dental rolls? Oh, I'm able to do it for 15 minutes, doc. Well, I can't make it much past there because at 15 minutes, it's really starting to let go and reform its shape, and most patients can't handle it. But eventually you win, and you end up with a nice shared curve like that, instead of all the curvature down here, wearing it out, and of course when you're popping it, like your videos are showing turning yourself sideways and popping, 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 popping. Because it pops the whole thing sometimes, but if these are real stuck, it won't pop them at all. But you're getting a loud click right out of here because it's the best part of your spine. It's already doing all the work, and now you're twisting and cracking it and making it work even harder and making it looser. So even when you move normally around the office or around your world, it's going to be doing all the work here. And you wonder why L4 and L5 are herniating and rupturing all day long and get pain down there. The way to stop the pain down here is not to keep cracking and manipulating it. It's to work and get this movement up here, because how do these look on x-ray? Brand new usually. Very little trouble up here. I've never seen a herniated disc hardly up here. Very rarely. All the time, all day long, down here, these bottom two are rupturing. What are they doing? They're rupturing, hitting this nerve here, coming out the side, or if you take this and chopped off and look down the canal, you'd see a stenosis, which means the canal is getting filled in with calcium, or stenosis like that. So that can happen at the bottom. That's horrible, living with stenosis. Not much you can do with that. I mean, we don't have any way to dissolve that bone once that canal closes down at the very bottom. Why is it closed down? I think I described before. Calcium deposit. If you keep moving an area, if I keep tapping, let's say I just tapped my skin right here for 3 months and then took an x-ray of it, you'd see a white haze from the irritation of me tapping it. So if you keep cracking it, keep cracking it, keep cracking it, keep cracking it, you're irritating it. That's calling calcium. Bring me down some calcium, Joe. He's moving too much here. Same thing like the ditch digging. When you dig a ditch, what do you get on your hands? Calluses. Is that a disease? It's not a disease. It's a normal adaptation to stress. Stop digging ditches, become an accountant. Hands get soft again. The body's very efficient. So that calcium you see depositing in there is happening because the body's doing that to defend itself. And when you stop abusing it, stop cracking it, and that's why it happened to me. People were cracking my low back at that L5, and now it got all filled with calcium, and I had to reverse that procedure, that process. And you do that by keeping it still, which means in yoga, you make sure you're breathing with your belly. You're doing the half moon. You're not doing, see, that's holding L1, 2, 3 stiff where the diaphragm is, and all the lateral, all the half moon is happening at L5, S1. Instead of breathing, making sure, or putting that one guy was putting his foot right up into the L5. He's making L5 move. Move your foot up there to L1, 2, 3. That's the area you want to get. And you'll see Dr. Brenda, I saw her the other night, walking on somebody's back. You're trying to do that. You don't walk on L5, S1. It's already moving too much, pinching nerves, rupturing discs. Stay away from that. So that's pretty cool. Here's the neck general. Same thing. You're trying to, this goes up at C1, C2, making it curve there to make sure you can steal away. Most of the curvature and abuse is down at the bottom, L5, T5, C5, C6. So you want to move that up to here by using this general. This is the neck one. You can come in the office and learn about these. They're pretty cool. Take care. Like and subscribe. Ring the bell.